My name is Jessica Miner, and I'm a family nurse practitioner student at Auburn University. This is a public service announcement about nurse practitioners and role awareness in their public sector.
Oh, my back. Oh, goodness. I really wish there was a doctor around. I guess I could do that State Farm thing. Like they say, like a good provider, a doctor is there. Oh, where'd you come from?
You called.
I asked for a doctor. I really need a doctor about my chronic back pain.
Oh, well, sir, I'm a nurse practitioner. Nurse practitioners can actually help manage acute and chronic illness.
I just don't think a nurse can do nothing for me right now.
Okay, well, I would love to educate you on that. Do you have a few minutes?
Yes, of course I do.
Okay.
This is a presentation regarding the role, acceptance, and awareness of nurse practitioners. The role of nurse practitioners. Nurse practitioners use advanced assessment techniques to treat and diagnose acute and chronic illness across the lifespan. They also implement evidence-based practice interventions to promote quality, patient-centered care. They order and interpret diagnostic laboratory studies to determine diagnoses and treatment options. They also collaborate with physicians and other members of the healthcare team. They refer patients to specialists when needed, and they provide educations to patients and families regarding treatment and disease processes. For education and certification, nurse practitioners obtain graduate level education, typically a Master of Science degree in nursing prior to licensure. There are many national certifications that nurse practitioners can obtain. These are dependent on specific states that the nurse practitioner may practice in and those specific Board of Nursings. For the Alabama Board of Nursing, they recognize several different national certification agencies. Two of which that I would like to highlight in this presentation include the American Academy of Nurse Practitioner Certification Board, the AANP, or the American Nurses Credentialing Center, ANCC. Some example of potential practice sites include urgent care clinics, primary care clinics, specialty clinics, including, for example, pediatrics or cardiology, nursing homes, rehabilitation centers, long-term care facilities, and educational settings. Prescriptive authority. Depending on specific state requirements, in Alabama, nurse practitioners can prescribe non-controlled substances. Specialty certification for the prescribing of controlled substances is required. So why nurse practitioners? Nurse practitioners can address primary care shortages. A recent study examined the impact of health disparity and access to primary care on chronic conditions in several states including Alabama, Mississippi, Colorado, and Utah. The management of several chronic conditions including diabetes, hypertension, and obesity were compared among these states. It was found that two of the major problems that affect patient outcomes include the affordability of healthcare services and access to primary care providers. Results have indicated that vulnerable populations, including the poor, racial minorities, and those in rural communities, are most affected. The Affordable Care Act included a push for increased primary care services. Nurse practitioners can meet these needs because studies have shown they are more likely to serve vulnerable populations, and they provide cost-effective care and have higher rates of patient satisfaction. This study revealed that in Alabama and Mississippi, chronic conditions were more prevalent, and these states have the highest rates of unemployed, uninsured, vulnerable communities. There are over 70% of nurse practitioners nationally that serve in primary care sites. For the management of chronic conditions, there was a survey completed in 2018 that was used to assess nurse practitioners' care in primary care settings and the effect of this care on other chronic conditions such as asthma, diabetes, and cardiovascular disease. Results from the survey indicated that nurse practitioners in these settings had a more flexible schedule to implement patient education, which improved outcomes such as medication management. The main takeaways for this presentation: nurse practitioners can provide primary care services to patients by assessing, treating, and managing acute or chronic illness across the lifespan. Nurse practitioners collaborate with physicians and other members of the medical team to provide high-quality, patient-centered care. Nurse practitioners serve in a variety of settings, including primary care sites and specialty clinics. Alabama and Mississippi have high rates of chronic conditions and vulnerable populations when compared to states such as Colorado and Utah. Nurse practitioners can address the primary care shortage in these areas by providing care for poor minorities and rural communities. Multiple studies have shown the benefits of nurse practitioners in primary care roles. These benefits include improved patient satisfaction, improved patient education, and cost-effective care. These are the references used to create this presentation.
So after watching your presentation, I had no idea that nurse practitioners could treat like chronic illnesses and stuff, like my back pain. What all could you do for me?
Nurse practitioners can help and collaborate with physicians. They can refer you. Nurse practitioners can also manage acute illnesses like strep throat, things like that. So they can do acute, chronic illnesses and help diagnose and treat and manage those things.
Wow, so you could actually be like my primary care provider, like a doctor?
Yeah, nurse practitioners can work in collaborations with physicians in order to provide primary care services.
Could you like transfer me? Could you like give me a referral to like an actual back doctor if I wanted to go see one also?
Absolutely. We can refer you to different specialists based on your needs.
Oh, wow, that's great.
Thank you for letting me educate you today, sir.
Well, thank you.